we have to recognize that over 90% of cancer care is now done in the outpatient setting. And in that setting, we're seeing an increasing challenge in terms of access to the services of the registered dietitians. And this is in part due to a reimbursement system that is antiquated and isn't keeping up to the current trends in medical oncology. And we need to be able to ensure that our cancer patients, when they are in an outpatient setting receiving their treatment, are able to take advantage of nutrition support services. As we move beyond the acute treatment phase and move into survivorship, many of our cancer patients are prone to making, shall we say, poor decisions with regard to nutritional support. They're being educated by high school students working in the local alternative and vitamin store, or by those who are purveying various nutritional interventions on the television. We really need to ensure that folks are able to get state-of-the-art, up-to-date nutrition information to enhance their survivorship. And indeed, cancer therapy, whether, again, it's radiation, surgery, medications, biologic therapies, leave many people vulnerable to nutritional complications. And we need to ensure that whatever those longer-term and short-term outcomes are, that the nutrition support to ensure their quality of life and ensure their survivorship are in place and available to everyone to utilize. Finally, when we think about the cancer problem and the enormous cost, I'm looking ahead 5-10 years, and I see some enormous challenges coming down the pike. As we look at what I'm doing in clinic, and I'm seeing medications in pill forms that cost $10,000 a month, I'm seeing IV therapies that may cost $250,000 for one patient. We're seeing an enormous challenge as to how we're going to be able to afford this in the future. And indeed, ultimately, prevention is the most important. We need to be able to identify those who are at high risk, either because of their family history, genetics, exposures that they've had in the past, such as tobacco, and define the interventions that are based on good diet, nutrition, and lifestyle in order to prevent the cancers from ever occurring. So in summary, we're not bringing the knowledge that we have accumulated over decades of research to the benefit of cancer patients today. And we need to be doing that more efficiently, and we need to be doing that with the kind of reimbursement that allows this field to grow. In this way, we're going to enhance the survivorship, the quality of life of all of our cancer patients. In the short run, I definitely support the objective of the organizations to have a workshop sometime soon that will focus on how to establish these standards for outpatient registered dietitian services, how this effort can be fiscally sound, and how we are going to make sure that nutrition support for cancer prevention and indeed other disease prevention is brought into primary care.